Hello, my name is Mark. Welcome to Be Doctor Ready. In this video, you will learn 100 facts about type 1 diabetes, and presented side by side are 100 misconceptions about it.
Let's go!
Type 1 diabetes is an autoimmune disease in which the body destroys insulin-producing beta cells. It is not caused solely by high sugar intake or poor dietary habits. Unlike type 2 diabetes, type 1 often requires lifelong insulin therapy from the point of diagnosis. It cannot be treated just by diet and exercise alone. Type 1 diabetes can be diagnosed at any age, from infancy to adulthood. It is not exclusively juvenile diabetes. Patients with type 1 diabetes must carefully monitor blood glucose levels multiple times a day. Skipping blood glucose checks isn't advisable even if one feels fine. Symptoms may include extreme thirst, frequent urination, and unexplained weight loss. They aren't always obvious, so early diagnosis can be missed. Insulin injections or an insulin pump help regulate blood sugar in type 1 diabetes. Oral medication alone, like some type 2 meds, isn't sufficient for type 1. Type 1 diabetes is not preventable through current medical knowledge. It's not something you can prevent by just being healthier. Untreated. Type 1 diabetes can lead to diabetic ketoacidosis, DKA, a life-threatening condition. DKA should not be mistaken for mild nausea or a typical stomach bug. Family history can increase the risk of type 1 diabetes, but many diagnosed have no family history. Genetic predisposition isn't the sole cause. Environmental factors also play a role. Managing type 1 diabetes involves balancing insulin, diet, and activity levels. Just avoiding sweets isn't enough to manage it. Early signs often include fatigue and blurred vision due to high blood sugar levels. These symptoms aren't always attributed to diabetes and can be mistaken for other conditions. Strictly controlling blood glucose can reduce the risk of complications like neuropathy. Perfectly controlled blood sugar doesn't cure type 1 diabetes. Immune system cells attack pancreatic beta cells, leading to insulin deficiency. It's not just about the pancreas wearing out due to high sugar intake. Insulin pumps deliver continuous insulin, mimicking a healthy pancreas more closely. Pumps are not a permanent, effortless fix. Users still need to monitor and adjust settings. Continuous glucose monitoring, or CGM devices, help track blood sugar trends in real time. CGMs are not a substitute for all fingerstick tests, but can greatly reduce the frequency needed. Rapid-acting insulin is taken before meals to manage post-meal blood sugar spikes. This insulin does not stay in the body all day and must be timed carefully. Basal insulin is a long-acting form used to control blood sugar between meals and overnight. It should not be confused with bolus or rapid-acting insulin. Counting carbohydrates is crucial to dosing insulin accurately. Carb counting is not the same as a generic low-carb or fad diet approach. High blood sugar over time can damage blood vessels, leading to complications in eyes and kidneys. These complications are not immediate, but can develop gradually without good control. Hypoglycemia, or low blood sugar, can occur if insulin is taken without enough carbohydrates. Low blood sugar symptoms shouldn't be dismissed as just anxiety or skipping a meal. Insulin therapy must be adjusted during illness, exercise, or stress. There is no one-size-fits-all insulin dose for all scenarios. Healthy eating for type 1 diabetes includes balanced meals with controlled carb intake. This eating plan is not about total carb elimination or extreme diets. Diabetic ketoacidosis, or DKA, can present with abdominal pain, vomiting, and fruity-smelling breath. These signs are often mistaken for infections or stomach flu. Blood sugar monitoring can be done via fingerstick or CGM sensors attached to the skin. Relying on feeling alone to gauge blood sugar can lead to dangerous highs or lows. A 1C test measures average blood sugar levels over about 3 months. A 1C is not a real-time reading of blood glucose and won't replace daily checks. Some type 1 patients experience a honeymoon phase after diagnosis, temporarily needing less insulin. The honeymoon phase doesn't mean the condition is reversing or cured. Type 1 diabetes can lead to nerve damage in feet and hands if poorly controlled. Neuropathy? Neuropathy isn't simply caused by wearing tight shoes or poor posture. Insulin must be stored properly, usually refrigerated, to maintain potency. Leaving insulin in high heat or freezing temperatures can render it ineffective. Dehydration can worsen high blood sugar levels. Drinking water alone won't lower blood sugar sufficiently without proper insulin. Frequent urination and excessive thirst occur because the body tries to flush out excess glucose. Drinking more fluids helps prevent dehydration, but doesn't solve the root cause, lack of insulin. Regular eye exams are essential because of the risk of diabetic retinopathy. Vision changes shouldn't be dismissed as normal aging or just needing glasses. Strong emotional stress can affect blood sugar control and insulin needs. Stress alone doesn't cause type 1 diabetes but can exacerbate blood sugar fluctuations. Insulin dosage might require adjustments in hot weather or cold climates. Environmental factors affect insulin absorption but don't eliminate the need for medication. Exercise increases insulin sensitivity, often requiring dose or carb intake adjustments. You can't always just push through with the same insulin dose when changing exercise intensity. Monitoring ketones via blood or urine tests is important when blood sugar is consistently high. Ketones are not harmless byproducts. They can indicate impending DKA if levels rise too high. Medical ID bracelets or cards are recommended for those with type 1 diabetes. Relying on others to guess a medical condition in emergencies can be risky. Type 1 diabetes can lead to skin issues, including slow healing wounds. Slow wound healing isn't just normal bad luck or poor hygiene. Some individuals with type 1 diabetes use insulin pens for convenient dosing. Insulin pens are not necessarily more accurate than vials and syringes. Technique still matters. Celiac disease is more common in individuals with type 1 diabetes due to autoimmune overlap. Not everyone with type 1 diabetes must go gluten-free unless confirmed celiac is present. Untreated or poorly controlled type 1 can lead to coma or even death. It's not a mild condition that can be ignored once diagnosed. Emotional and mental health support is crucial in managing type 1 diabetes. Therapy or counseling isn't a sign of weakness. It helps with coping strategies. Insulin therapy can be expensive and may require insurance or patient assistance programs. Cost should not lead to self-rationing insulin, which is dangerous. Blood sugar targets can vary by individual, especially for children versus adults. There is no universal perfect blood glucose target for everyone at all times. Regular dental checkups are important because high glucose can impact gum health. Poor oral health isn't always from inadequate brushing or flossing. Sugar-free products can still raise blood sugar if they contain carbohydrates. Sugar-free doesn't mean carb-free or safe to consume without consideration. Pregnancy with type 1 diabetes requires close monitoring to protect the mother and baby. A healthy pregnancy is possible with proper management. It's not automatically high risk without care. Polyphagia, or increased hunger, can be a symptom of uncontrolled type 1 diabetes. constant hunger isn't always due to boredom or poor eating habits. Diabetic retinopathy can be prevented or delayed with good glucose and blood pressure control. It's not an inevitable outcome if one properly manages their diabetes. Insulin resistance can develop even in type 1 diabetes due to weight gain or other factors. Type 1 individuals aren't immune to insulin resistance, which is often associated with type 2. Glucagon injections, or nasal glucagon, can treat severe hypoglycemia when the person is unconscious. Glucagon is not for daily use. It's an emergency measure, not a sugar pill. Beta cell transplant or whole pancreas transplant is an option for some with type 1 diabetes. Transplants are not widely accessible or guaranteed cures. Lifelong immunosuppression might be needed. A dawn phenomenon can cause elevated morning blood glucose levels. This is not always caused by late-night snacking. Some individuals experience weight loss before diagnosis because their body can't use glucose properly. Weight loss is not always a sign of healthy dieting or exercise success. Maintaining consistent mealtimes can help stabilize insulin dosing and blood glucose. Random meal schedules can complicate insulin requirements significantly. Polydipsia, excess thirst, polyuria, excess urination, and polyphagia, excess hunger, are classic triad symptoms. They're not just normal increases in appetite or thirst. Intensive insulin therapy attempts to mimic natural insulin release and often involves multiple doses per day. It's not the same as insulin stacking, which can be dangerous if done incorrectly. Blood glucose meters require quality control checks to ensure accurate readings. Faulty test strips or expired solutions can give misleading results. Type 1 diabetes can lead to complications like gastroparesis, delayed stomach emptying. Chronic indigestion isn't always from acid reflux or food sensitivities. Insulin is a hormone that allows cells to absorb and use glucose for energy. It's not a medication that fixes the pancreas permanently. Stress hormones like cortisol can cause blood glucose to rise, necessitating insulin adjustments. Emotional distress isn't the sole driver of high sugar, but does play a role. Alcohol consumption requires caution because it can cause delayed hypoglycemia. Alcohol doesn't only raise blood sugar, it can lead to drops hours later. Protein also affects blood sugar, though more slowly than carbohydrates. Focusing only on carbs can overlook protein's eventual glucose impact. Regular foot exams are recommended to catch early nerve damage and prevent ulcers. Foot care is not just for the elderly. Type 1 patients of any age should be vigilant. Multiple daily injections, or MDI, is a common insulin regimen approach. MDI isn't less effective than a pump if done correctly. It's about personal preference and accuracy. Post-meal blood glucose checks help fine-tune insulin doses. Checking only fasting glucose misses how meals affect blood sugar. Undiagnosed. Type 1 diabetes can sometimes be mistaken for the flu or stomach bug. Persistent symptoms shouldn't be ignored if they last longer than typical viral illnesses. Medical research is exploring immunotherapy to slow or halt beta cell destruction. There is no widely available therapy that completely stops the autoimmune attack yet. Having type 1 diabetes puts some individuals at higher risk for certain thyroid disorders. These thyroid issues aren't purely genetic. They can be autoimmune related as well. Severe hypoglycemia can cause seizures or loss of consciousness. Shakiness and sweating are mild signs. Advanced lows can be far more dangerous. Keeping a diabetes journal on food, insulin doses, and activity helps identify patterns. Guessing insulin needs without data increases risk of hypo or hyperglycemia. Technology like closed-loop insulin pumps, artificial pancreas is evolving to automate dosing. These systems are not fully autonomous or set-and-forget solutions yet. Vaccinations are important because infections can destabilize blood sugar. It's not correct to assume mild illnesses won't affect glucose levels. Insulin shock refers to severe hypoglycemia from excessive insulin or not enough carbs. It's different from diabetic ketoacidosis, which is caused by too little insulin. Blood ketone testing offers a more precise measure of ketones than urine strips. Urine ketone tests lag behind actual levels and may be less accurate. Stress relief practices like meditation or yoga can help reduce glucose fluctuations. These techniques don't replace the need for insulin or medical management. Sweets and desserts can be consumed in moderation if insulin and carbs are properly balanced. Type 1 diabetics must never eat sugar is a myth. It's all about management and timing. Some people with type 1 experience hypoglycemia unawareness, losing early warning symptoms. They can't rely on feeling low and need vigilant monitoring. Regular blood pressure checks are vital because hypertension can worsen diabetic complications. High blood pressure is not just a separate cardiovascular issue. Elevated blood sugars during childhood can impair growth and development if not managed properly. It isn't always just about immediate symptoms. Long-term effects are significant. Insulin pen needles and syringes come in different lengths. Proper selection can improve comfort. One-size-fits-all needles can lead to inconsistent insulin delivery. Certain autoimmune markers, such as GAD antibodies, help confirm type 1 diabetes. Type 2 diabetes rarely involves these specific autoantibodies. Honeymoon phase insulin needs may be minimal, but it eventually ends as more beta cells are destroyed. It's not permanent partial remission of diabetes. Weight can be normal, underweight, or overweight in someone with type 1 diabetes. It's not purely a skinny person's disease. Some individuals split their basal insulin dose to morning and evening for smoother coverage. A single daily dose might not suffice for everyone's glucose patterns. People with type 1 diabetes can still participate in sports at high levels, given proper management. Athletic success isn't off limits or hindered solely by having type 1 diabetes. Regular hemoglobin, A1C checks around every 3 months, guide treatment adjustments. An A1C test once a year isn't enough to track changes promptly. Certain infections or viruses may trigger autoimmune responses leading to type 1 in genetically predisposed. It's not always purely genetic. Environmental triggers can play a role. Low-carb diets may reduce insulin needs but require careful medical supervision. Extreme low-carb eating doesn't eliminate the need for insulin altogether. Foot ulcers in type 1 diabetes can progress quickly without proper wound care. Minor cuts aren't always harmless if blood sugar is poorly controlled. Some people experience double diabetes, having type 1 plus insulin resistance typical of type 2. Weight gain or genetics can exacerbate insulin resistance, even in type 1. Alcoholic beverages can mask hypoglycemia symptoms, making them harder to notice. It's not safe to rely solely on hunger or shakiness to detect a low. Tech-based apps can help track meals, insulin doses, and blood glucose trends. Technology alone cannot manage diabetes without user input and healthcare guidance. Some type 1 diabetics develop lipodystrophy, fatty lumps or scar tissue, from repeated injection sites. Rotating injection sites is not optional. It's crucial for proper absorption. Stress hormones like adrenaline can spike blood sugar during intense exercise or excitement. this rise isn't always related to food intake or insulin underdosing. Having type 1 diabetes does not shorten one's lifespan if managed properly with modern therapies. Severe complications can reduce life expectancy if poorly controlled. Ketogenic diets in type 1 diabetes must be monitored carefully to avoid ketoacidosis. Being in ketosis for weight loss is not the same as dangerously high ketones from insulin lack. Some insulin can be inhaled, although injectable insulin remains the most common therapy. Inhaled insulin is not suitable for everyone, especially those with lung issues. Sweating, trembling, and confusion are early signs of hypoglycemia needing immediate attention. It's not something to sleep off, as it can worsen quickly. Brittle diabetes refers to type 1 with frequent, extreme blood sugar swings. It's not an official subcategory, but describes hard-to-manage fluctuations. With proper tools and support, many people with type 1 diabetes live active, fulfilling lives. A type 1 diagnosis is not a life sentence of limitations. We hope you learned a lot today.
Thank you.
Please subscribe and be ready for your doctor.